Mount San Rafael Hospital serves a small Colorado community, but their CIO has led a monster effort to bring down costs, drive efficiencies, and create an enviable collaboration between hospital staff and IT. Today's guest is Michael Archuleta, Chief Information and Security Officer for Mount San Rafael, and we're about to get into a tremendous exchange of thoughts and ideas on security, healthcare IT, collaborative culture, and consumerism. It's all right here on this episode of Red Hot Healthcare. Let's go.
This is Red Hot Healthcare. Interviews with today's leaders and all the news that matters. Here's your host, Steve Ambrose.
Hello and great to have you aboard. I'm your host, Dr. Steve Ambrose. For past and upcoming episodes, find us on iTunes and most podcast directories, or on our eye-catching website, redhothealthcare.com.
Today's episode of Red Hot Healthcare is sponsored by Walk the Ridge. Incivility between those of different opinions and views is skyrocketing. It's causing harm to relationships as well as results in corporate culture. Walk the Ridge is a movement that's free to join, and it stresses that people practice tips and strategies in better listening and more civility. Join for free and download our free guides for individuals and businesses at walktheridge.org. That's walktheridge.org. Walk the Ridge, promoting greater civility in our society. One of the most innovative CIOs with a driving passion for both consumerism and cybersecurity, Michael Archuleta led IT efforts to bring Mount San Rafael to win healthcare's Most Wired Award for the last 3 years. In addition to his leadership, Michael currently serves on the board of directors for the Neural Network. He's a healthcare ambassador for Fujitsu of America and a sought-after speaker on healthcare IT. He's also considered one of the top CIOs to know by Beckers. Michael, welcome aboard Red Hot Healthcare.
Hey, thank you, Steve. It's definitely an honor to be here. Thank you very much.
Well, let's go ahead. We're going to just come right out of the gate storming today. And I know I'm going to get into a subject throughout the talk today about cyber attacks. And I know it's super prevalent in healthcare now. I know it's an area that you're very passionate about. You've been quite outspoken about some of the shocking stats in maybe how unprepared a lot of hospitals and their staff are for this. And I'd like to just open up to you. Maybe you can just give our audience sort of not only an overview, but maybe some more information on those stats.
Yeah, absolutely. So, cybersecurity is such a huge thing. And I always look at it as being a top priority. 43% of individuals nationwide did not even know what ransomware is. And that is such a high number. And honestly, if you think about it, healthcare being one of the most attacked sectors out there, and I go to these conferences and we're constantly talking about the technology, and the technology. Where do the people stand in regards to this? Instead of technology, process, people, we're doing it wrong. We need to focus on the people, process, then technology. 91% of all cyber attacks start with a phishing email. And we ask ourselves, well, what is a phishing email? It's basically an email that looks very legitimate, sent to an actual employee or any individual in an organization. They click on that specific email and malicious code gets sent to your overall system.
And all they have to do is click on the email, right? They don't even have to click on an attachment in it.
Well, this is a thing. So even though you get a phishing email that may contain ransomware, there's always an activation button. Most of the times it's like, click here. So you're actually you're allowing that individual into your system. If we don't focus on the overall culture and make a big difference on teaching these individuals on what would happen if a cyber attack basically came into this organization, what happens during a breach, what are some of the financial consequences that a breach can have on a healthcare organization? And the reason why we click on items is because we're curious about things. Steve, I want to talk about what we did as an organization here.
Yeah.
With cyber attacks being a number one hitter and seeing phishing emails really coming in, I created a program, and the program was called Clickers Anonymous. I wanted to determine how many individuals in the organization were basically considered clickers. So the simulated phishing test basically stated that you have an email from HR, you need to update your insurance information, please click here to update per your records. 43% of the individuals in this organization basically clicked on that email. After that, I was like, we have a major problem. It only takes one individual to click on something that's going to damage or have malicious code in it too. And what a lot of people don't know is that medical record, personal health information is 10 times more valuable on the black market than a social security and a credit card.
Yeah, now explain that. Explain what you mean by that, because I think a lot of people just take that number and it just rolls over. Take it through how a hacker would get some information and then what they would do with that information to maybe monetize it or use it for, malicious use.
So medical records really contain an extensive amount of data, from a person's full name, address, contact information, social security number, insurance details, name of treating physician, diagnosis, treatment, and more. When this information is used for fraud and other scams, criminals can make significant sums of money. And once information has been stolen, it can be resold over and over again, which is why healthcare information is so valuable and at the same time so dangerous. We are just used to what we call the surface web. Your surface web is where you do your searches, your Yahoos, your Googles, etc. There is another area that hackers, criminals basically use, and that's called the dark net. The dark net was basically developed by the military, which is a fully encrypted area, which allows these specific criminals to post up information, to sell medical records, to sell forgery, fraud, identity theft. And going into these specific sites, you could look at guns, ammunitions, explosives, electronics, digital goods, drug paraphernalia. And the crazy thing is we have to keep up to date with these specific trends. So we're constantly validating, verifying, and making sure that nothing is getting placed or leaked over on the dark net. There was a site out there that had 397,000 patients from Atlanta, Georgia, United States. And the way they have this laid out, it's just like a website. You go to Amazon, you select the quantity, you select the postage options, and it shows you the overall price, which is basically identified in Bitcoins, and you buy it. And I mean, it's a major issue.
Mike, you came into Mount San Rafael Hospital when it was basically all paper back in 2008. So since that time, I was reading you designed the first data center for them. You added in something called virtualization, and then you jacked up the EHR or the EMR uptime. It was at about 50%, and now it's at about 99.99%. But I want you to share with the audience a bit more about the vision you had before any of this actually happened back in 2008 when you first came on. And then as you were implementing all this, what were some of the biggest hurdles that you found along the way?
When I came into this organization, everything was paper. This organization was a late adopter in implementing the electronic medical record system. My first task was, okay, you now need to create and validate some vendors and try to get an actual EHR in as soon as possible. I said, okay, so what's soon? So at the time, we needed to start our 90 days April 1, and I needed to be live and up and active by March 30th. I had a consulting group come out to measure the overall current infrastructure, the current staff that was basically in place, and just looking at, well, what are you planning on implementing with your first EHR? Well, I need mostly every single module available when it comes to physician documentation, computerized provider order entry, electronic prescribing, to be successful in meeting the meaningful use objectives. So when they came back, they said, okay, you have no data center, you have legacy products, you have no staff that has that type of ability to basically make a change. You have home-based wireless systems throughout your whole organization with different SSIDs throughout. You have a success rate of 20% and actually going live the time you need to.
Oh,
I kind of looked at it and I said, man,
Yes.
I'm kind of getting myself into something extremely deep. I came in when there was literally nothing. And the problem is the facility did not have an overall technology strategy in place. Technology was really deprived. When I walked around this whole facility, I saw that servers and switches were basically in housekeeping closets. So housekeeping closets were really considered their overall data center.
Oh,
And
my
like I said,
goodness.
yeah, I mean, it was absolutely insane. I mean, I kind of even at the time, I even took a double take in it and thinking, this is going to take a lot of massive amount of work to do an overall digital transformation. We have older nurses on the floor that basically have never used a computer in their lives. Everything has been paper. We're going to do a massive disruption to our physicians and our clinicians. And I'm wondering, will I need witness protection after this once I implement everything?
And heavy medication.
It was kind of funny. It was really a humbling experience to see that. But the consultant came back and stated that you have a 20% chance of actually going live this specific time frame. And I could really say honestly, having the support of the board of directors and administration and needing everything that I needed to do to make this digital transformation an actual reality was really a critical thing. And this was literally days and nights working on getting the team built, from the data center built, to centralizing the overall products, to really making and building and designing the first data center. So everything was a physical server in place. Then when I came in, we virtualized every specific single aspect of the environment.
I want to transition this into a question here that we're going to save for later, but I think now's a great time to jump into it. You're making everything much more efficient. You're optimizing. You're driving up the rates of EHR uptime. But there's another side to this, and that side is the physicians and the care teams. There's older nurses there. There's folks, a lot of them, have never worked on computers. You take in a massive, as you called it, a massive disruption, which it was with IT at Mount San Rafael. And I want to go ahead and maybe ask just two questions here, Mike. The first is, it couldn't have been all smooth sailing with integrating this with the people. So maybe number one, what were the toughest challenges? And then number two, what were some of the biggest mistakes along the way that you might have made?
I think at times mistakes are always a learning opportunity of never doing it again and basically improving with your process. But during this massive digital transformation, my overall key is we have to communicate properly to our physicians and to our clinical staff members. When I'm selling a project to the board of directors, I create an overall graph and an overall story that tells them, this is why we are doing this. I promise you, ladies and gentlemen, I am not doing this to ruin your life. This at the times was a mandated project that needed to take place. If not, this organization was going to be penalized. At the end of the day, I always say, let physicians be physicians. These electronic medical record systems have really put burdens in their overall on how they practice patient care, because they're focusing too much on that machine versus focusing on the actual patient itself.
Yeah.
But at the bottom line too is we have an electronic medical record system. How do we as an organization basically utilize this system in a meaningful way? Because when CMS came out with the requirements of meaningful use, I mean, their overall goal was, how do we improve on patient care, patient safety, patient efficiency, better communication, better continuity of care, better sharing of information? The overall idea was was a good idea. But the thing is, though, is we really jumped into this. And if we don't have proper champions in place to help build that overall case and that understanding of the importance of basically implementing this product. At the end of the day, if you can really engrave and improve on that culture change, this is a reason why we're doing it.
One of the things I hear from you is just the importance of communication. It seems like to me when you start cracking out success, it's not just a matter of laying out what Medicare wants or what payers want. It's sort of like that empathy for being able to bridge out, right? And sort of recognize where the nurses are coming from who've never used a computer. And as you said, installing those champions where you can't be everywhere, every time. So you were saying, I don't want to cut you off too much, but you were saying that the use of champions made a huge difference.
The use of champions made a tremendous difference. Utilizing the physician champions to speak colleague to colleague, nurse to nurse was really a big thing. And then, of course, knowing that we had support from top down was extremely critical moving forward. Because at the end of the day, we build that overall case and that understanding and the reason why we're going in this direction. And having the trainers in place and having that support from IT going into helping the physicians, helping the clinicians. And then, of course, what I developed too was a lot of governance around improvements. How do we improve the system to be more efficient for you as a physician? How do we do it to be more efficient as a nurse, etc., towards all our clinicians? Because at the bottom line is, yes, we have this electronic medical record system in place, but how do we use it in a meaningful way that's going to improve the overall aspect of patient care? And at the end of the day, I don't care what your job title is. If you work in healthcare, our number one priority is patient care, period. And that is what we need to focus on constantly.
I did a lot of reading on talks you've given in the past, but you really talk about the workflows of employees, not just putting people first in understanding, but the actual understanding of how employee workflow can really improve cybersecurity. And maybe just if you could, on a very broad level, give us an example of that and maybe explain it a bit further.
As a CIO, we should not be in front of our computer 24/7. As an actual individual in healthcare, I love doing rounds. I love working with different departments. I love learning what are the issues that these specific departments are doing. So like, for example, this department, I'm not going to say who, but they were utilizing the same username and password. That is such a major breach. But the thing is why were you doing it?
Right.
To understand, well, okay, it does make sense now because it would really create a burden for the patient if you had to do it this way. So really learning from the departments and really understanding is critical. I think a lot of these CIOs at times really don't try to learn for those specific aspects.
Right.
They just like hearing instead of actually seeing and doing and understanding those employees. Because at times you hear individuals, well, the executive team doesn't know exactly what we're doing. We're here in the trenches working. We have to do these different processes. It is so hard for us to do this. It reduces patient care. It takes more time. I have less time with the patient. Okay, I understand that. But where are the gaps? Where are the issues? Let me learn from it so then I can create a better process of you utilizing the system. Because at the end of the day, you are creating a breach, a potential breach that could come into this organization, and you would be accountable for that. So how do we get rid of that aspect? And how do we improve on the focus of the importance of cybersecurity? Cybersecurity is an inconvenience. I mean, it is. But the thing is if we don't have those strong rules in place, we're going to continue to be breached as an organization moving forward, especially healthcare sectors.
You're going to be at the roundtable at HIMSS for the importance of medical device security. As we both know, we're growing increasingly interconnected as value-based care, population health. We have to know more about people. And people on their end really have to be willing to give more, to understand everybody has to contribute here to make the healthcare system healthier and more sustainable. When we talk about medical devices and the security that goes around that, I'd like you to give our audience really just an idea of your biggest concerns in this space. And then maybe on top of it, What do you think are the most promising medical device technologies over the next few years?
The problem is the FDA definitely has some issues when it comes to medical devices. Can the heart be hacked? Well, we've kind of determined that there has been 8,000 security flaws in the pacemaker software alone. This is a medical device that is placed in your heart to keep you alive. These group of MIT students, they wanted to kind of determine if they can actually hack a pacemaker and kill a man. So what they did was they basically got into one of these mannequins, these high-end mannequins that are basically used for medical students. They hacked into that pacemaker and they stopped the heart then and there. We know that the FDA is calling for continuous collaboration in medical device security, making cybersecurity a matter of life and death. As medical devices become more digitally interconnected and interoperable, they can drastically improve the care that patients receive. But at the end of the day, they're also vulnerable to security breaches that can affect a patient's life. And this is a scary thought, too. About 83% of medical device makers admit they are not fully secure. But the issue doesn't lie solely at the door that the medical device makers. Healthcare organizations also must rethink how they manage, monitor, and protect these devices at the end of the day. So when it comes to medical devices, and me honestly being a really high-end advocate when it comes to cybersecurity and health, these individuals, if we're seeing stats that 83% of these organizations know that there are security flaws in their product, they need to make a change, period, which definitely matters. This could be your mother, your father, your sister, your brother, your family members. With medical devices, really, as I stated, being so interconnected, it's critical that we start improving on these specific matters, improving the FDA's guidelines of making it more of a mandatory to improve cybersecurity into the medical devices that they basically have. According to an FDA safety communication, they stated that cybersecurity for medical devices and hospital networks, medical devices manufacturers should take steps to assure that appropriate safeguards are included in medical devices to reduce the risks of failure due to a cyber attack. If that's your statement, FDA, you need to start mandating more towards those actual manufacturers and improving those specific outcomes.
I want to go ahead and switch gears. We talked earlier about consumerism. First, let me read you a quote from a very famous author, Michael Archuleta. You might have heard of him. Quote, accompanied by the high deductible health plans and cost-sharing models, consumerism has been steadily on the rise in the healthcare industry. Hospitals that are able to successfully handle these challenges may be in a better position to stay financially viable in a period when competitive pricing and patient satisfaction can make or break a hospital's chances of succeeding. And so to that quote, I couldn't agree more. I know you're a huge believer in patient engagement. You've made some investments at Mount San Rafael in different technologies and even different people around this space. Maybe you can just share on a very high level what some of those technologies are and maybe what some of the differences have been in terms of engaging patients.
I always try to incorporate the way the patients are basically trying to think and the tools that they need to improve their overall aspect of care. So when we had patients coming in to our organizations, they were basically looking at some of the HCAP scores. They were having problems and they were complaining about long wait times. What I did was, and I'm always about governance, is I wanted to basically combine and collaborate an actual neighborhood committee that would come in and kind of show and hear some of the flaws that our organizations are basically doing and how we can improve some of those aspects by the utilization of technology. So wait time was a major problem. So they would come in, they would basically manually get a number from one of our greeters, and they would wait. But of course, if you're constantly looking at your watch and you're like, what's going on, man? I've been waiting here for 20, 30 minutes. we're human beings, so we like to, throw in maybe a little bit higher number. Well, I've been here for 10 minutes, but then now that's become 30 minutes. So then, of course, that gets out to the overall community. So what we did was we actually brought in a digital check-in system. The patient would walk in, they would basically get to a kiosk, they'd put in their information. That information would be selected over into the registration group. That registration group would know that they were basically here. And then there was a big LCD TV outside the patient waiting room on where they wait to be registered. And they were able to basically see their overall wait time. So then that 30 minutes now went down to 5 minutes, went down to 3 minutes. So then it basically improved the overall visualization of how we're bringing in our patients, how now we're listening on how do we improve that specific aspect. At the end of the day, we have to focus on what is important, and that is patience and understanding what they actually need. Loyalty is such a critical element.
We hear all about how wonderful and terrific AI is for the clinical side. And of course, we hear all about doctors aren't going to get replaced, people aren't going to get replaced, which I take a different opinion on, perhaps maybe than you do, Mike. As healthcare companies being businesses, which they are, I think their chief motive is profit. I'm not saying that their motive isn't to take care of patients and to serve patients and to do the best job and get satisfaction. All of that I know gets put in there too, and it's very important. But if a company doesn't remain profitable, it doesn't stay in business. Even nonprofits have to remain profitable to get the best talent. So the practicality of that, I think over time, we're going to see not job replacement necessarily, but I think you're going to see greater efficiencies, which might pare down the human workforce. Better results, right? But maybe not so much cost, since cost is such a big thing. I see AI really not being as strongly used in the operations end of hospitals and health systems. I mean, for as much talk as there is, Mike, on the clinical side, what about with the billing? What about with patient registration? What about with follow-ups with patients? You know what I mean? In other words, all those back-end people that work for hospitals and health systems, many of them operating manually now. More AI there, particularly as it surrounds, some of the more back-end processes.
Yeah, absolutely. So, when you discuss some of the other processes, there is a company out there that I'm extremely impressed with. They're basically incorporating artificial intelligence and really trying to state that this new AI becomes a valuable employee by automating repetitive, high-volume tasks that basically provide true interoperability by working with the systems and tools that you already have in place. If we look at even billing, such a repetition process doing verification, if you can have AI and machine learning coming into place and learning those specific aspects, yes, you then can improve your overall efficiency as an organization, reduce FTE count, and be more efficient and more effective of what you're basically doing. Such a huge thing. And this group, I'm actually having dinner with them at HIMSS, but they have done an absolute amazing thing. I try to make it say it as nice as possible. AI, I really don't like saying, well, AI is going to replace all humankind and we're basically going away. To a point, that is true. But to a point, too, though, is we have to embrace in this technology that could basically improve our overall aspects of what we do.
What is one thing that you believe to be true that very few people would agree with you on?
That is definitely an interesting question. I'm a young, innovative leader in healthcare IT. And at times, there's a certain respect that undeniably comes with age. Employees with decades of experience are often sought out for leadership roles, especially in healthcare. While age often goes hand in hand with expertise and experience, it's no longer the only signifier of a strong leader. You're never too old or too young to do anything. Don't ever let your age stop you from succeeding, because in the end, age is just a number.
Michael Archuleta, Chief Information Officer and Security Officer for Mount San Rafael. We thank you so much for being on the show today. An absolute privilege, pleasure. I enjoyed it so much, Mike. I know we've been trading off back and forth communications to make this happen, and I know your time is extremely valuable, so I just appreciate you spending it with us today.
Steve, thank you very much.
You've been listening to Red Hot Healthcare with Steve Ambrose. Subscribe to us on most major podcast directories. For media or business inquiries, reach out to media@redhothealthcare.com. Thanks for listening. This is Denny Colonna. We're out of here.